It's recording.
Pelvic floor.
Welcome.
Do our voices match our faces?
Are you
Is this what
surprised?
you thought?
Shocked? Aw.
Should we be wearing suits?
Next time. I like that we're
There you
both
go.
in blue, though.
We are, and I
Like
put on this very professional tie that
cat
Kelly got
bolo.
me. Yes, yes, cat bolo. Little cat bite out of it from my cat.
We,
So dressed up for you guys.
that's right. We love fashion.
Yeah,
Any type,
yeah. You can
any
tell my
place,
big
anyway.
Breckenridge sweatshirt and your big blue
I'm
sweatshirt.
in a full suit.
Oh,
You ready?
well, I mean, I hope so. Is that what's her name? Veruca? Is she the one that turns
The
into
blueberry suit.
which one is it? I don't think it's
Oh
her.
gosh, what's her name?
It's the
No, it
blonde
is
one.
Veruca. You're saying a V, right?
Yeah. It's how does it I was trying to think of the song. Oompa, oompa, you know?
But you do. I've got to bump up. If you bump, 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 bump. Is
Yeah.
any of
I
this
think
bringing
I
it
think
back?
Veruca's the squirrel girl. So I'm
Veruca.
like,
So who is the blueberry? But you're right. She was. I just remember her being this huge blueberry that they roll around.
exactly.
That's all I
Yeah.
remember. Um, this is
Anna
Pelvic
Sophia
Floor
Robb. Yeah.
Podcast.
You're right. Let's
Yeah,
get
yeah.
into it. This is pelvic floored.
Also, if anybody remembers the name of that lovely little girl, not so
Yeah.
lovely,
She
right? She was
wasn't
actually kind of a.
She was chewing a lot of gum.
Oh, that's
That
right.
was
She
like
was
her
the
thing.
gum girl. Yeah, that's her shtick.
Yeah. Yeah.
I would
Her
have.
gum
I would have.
shtick.
Well, yeah, see, the gum, see. Okay, wait. Do you think? Okay, if you were, this is a new segment. The new segment is before we start pelvic floor. If you were one of the Willy Wonka characters, like what would have brought you down?
Oh my God, that chocolate river.
I
Me and
thought
that
the
chubby
same.
boy.
My God, put me in a river.
I love chocolate. Yes, I
Yeah,
would be in that tube and I probably would have fit because I'm not that big. But
yeah. I feel like for all the love that I show raccoons, that maybe I should have been the squirrel girl,
yeah, close relative, It's like,
But
yeah, I could see that. I mean, she was really mean though, and you're
she
not
was so
mean.
mean. Oh,
Like,
thank you.
you would be that. I mean, doesn't he share his chocolate? No, he doesn't. He
No,
like
he's
offered and he's like, ha ha ha.
yeah. But I think I agree with you. Like the chocolate river seems like the way to go.
No, let's be real. We know exactly who we'd be. We'd be the old people laying in that bed.
We would foot to foot.
Yeah. What do you
I,
mean, golden ticket?
good luck, Charlie. We will be right
Take
here.
grandpa. He wants to go. He's faking. He can get up. Yeah.
I I feel like that's the best way to do a sleepover. That came out weird. Um, if you see it in the video,
The
but
one
like,
time that we had a sleepover most recently, I slept on top of your dog.
yeah,
Rudy
yeah,
was my pillow.
yeah. I mean, in fairness, that's how we sleep at night. He like
It was
around
the
my head.
best. He was so
Um,
warm.
he is a tank of heat. Like
Yes.
if
I run
anytime I'm like,
cold, so I
it's
was like,
cold,
yeah,
I do too.
he was like
Um,
a full human. So pelvic floored.
and tell us who you are. Who are
Oh,
you?
yes. This is pelvic floored with, I think you go first.
Okay, Dr. Kelly. Dr. Kelly Davis.
Not a doctor. Melissa Wright. It just
um,
flows better,
yeah,
No
I'm with you.
accolades, no
We're working on
credentials.
it. Wait, the credentials are look at this hobby.
This
Look at
is
this brilliant woman with a
patient. I'm
cat
forever
bolo
patient, Melissa
tie.
Wright.
No, no. Oh my gosh, I am a forever patient. Let me tell
I
you.
mean, I'm happy to be.
I Me too. I was limping today after my run. And I'm working on it.
Well, let's tell everyone how far you ran.
Oh, 9 miles today,
That's
which
crazy.
it felt it felt so good in the way of I was just like, man, I'm out here doing it.
Yeah,
It was so
that
beautiful.
you're so close to 13.
I'm so
Half
close. Two
marathon.
weeks. 2 weeks.
That is, yeah, that's amazing. I could never. And not
I'm
that it's about me, but like, I'm so impressed.
no, thank you. And I think this flows right into where like what's got you floored because
What's got you floored?
let me tell
Running?
you, yes, yeah, it's got me really floored. I mean, it is just, I don't know how runners do it. Like, training for this half has been crazy in the scope of time. Like,
Damn. You've been
like,
really disciplined though. Like you've
oh,
really,
thank you.
I feel like stuck to your
I'm
stuff.
trying. I'm trying. I've missed like a few runs here or there, but it was purposeful. If I missed a run, it was because I was either like I hit it hard the day before and I was just trying to give my body enough rest to like repair before, or I was like, listen, I got to choose some other things physically just to like support because I've been doing yoga and some cross training with it. But I mean, this morning I ran for an hour and 30 minutes, like hour
So long.
32.
I was texting Kelly like, "Hey, we got to record." And I was
I
tracking
mean,
your location. She just kept going, and I was like, "She is just going so far." Like I didn't even know where you were. Not that I am that good at geography in the
I'm not
city,
either.
but like I was like, "Oh, oh, she," and it kept telling me like 25 minutes away by car, 30 minutes by car, and I was like, "Turn around, Kelly. Turn around. I need you to come home.
You're too far. I
You're
know.
going away."
I like have ran to where on the Swamp Rabbit it's like starting to get into um past Sans I don't I'm gonna slaughter this Sansuchi
I think that's
Suchi
right.
Souchi
Sansucci?
into closer to Traveler's Rest. I got to where all those little trees are, but all of that to say, it's got me floored. I don't know how people who run marathons do it. Like you're just gone for hours at a time to
It
run.
is
It
a time commitment. Like you said, it's like you carved out an hour and a half of your time this morning and you had to go
just to
pretty
run.
early just to run. And
Yeah.
that's not even, yeah, a marathon. I'm like,
When people are like, "Yeah, I used to know this distance runner in grad school," and he was like, "Yeah, I just ran a quick 14." But also, I'm like, I guess if
quick.
your pace is
I mean, if your legs
seven,
are
six
like
minutes,
the length of my body, maybe.
yeah, but that's not my pace. So I'm like, what do
You had a
you
great
mean?
pace.
Thank you. Yeah,
10
around
miles in an
10.
hour and a half. That's, I mean,
Yeah,
9
about
miles,
10.
but yeah.
I'm happy. I'm astounded. I cannot believe my little legs can carry me so far.
That's a great
Um,
floored.
so okay, what are you floored about, Melissa?
What's got me floored? This one's probably kind of lame, but just
Hmm.
live music. We went to, our
Are you about to slaughter Fall for Greenville?
no, I'm not mad. My
Okay.
floors are always going to be like amazement because I don't know
Oh,
how to be
I love
mad.
that.
Like, well, it's, I don't know how to be angry.
Look at
So
you.
no,
I
just
love you.
amazed at, I feel like you're amazed by your running. Just like there was a band on doing like sound check, not even like they weren't really performing at that time. And they just put on like a whole show, just hanging out. Like I am just very
Casual.
amazed. And anytime I think about being on stage, I'm like, and then here we are on stage. No,
I know. I do
but
love that they're like, this is the stage. I'm like, yeah, it
you're
is.
backstage. You're in the wings. Oh, the host has to let you in. So yeah, just like I love that Greenville does that huge festival. It's one of the reasons that we like love living here, and it's just amazing. There's like 6 soundstage taking over the whole. I mean, you were there, like
I mean, no,
just
but tell the people.
what
It
a
was
production.
I was thinking about that with I kind of mentioned it to Alex, but I was just like, wow, how cool is this that it feels so Gilmore Girls, like these
Yeah,
huge festivals where
yeah. Our
they're like,
town
yeah,
does stuff.
they just invite everybody out and you see everyone. It's like everybody, their moms, their cousins, their
Yeah,
uncles,
and I was
grandpa,
feeling
grandma.
a little antisocial, and you guys know a lot of people, and all these people just kept coming up to us, and I was like. Not
Listen,
like I was so happy because they kept playing with my baby, and I was like, "This is great. He's having a great time. I can stand here." So
no, I feel
it's
you though.
good.
It's like you do see everyone and then you're like, oh, okay. I just want to
Well, it's also loud. I was
vibe
telling
to the
Austin,
music.
like, I just can't hear now. Like, I don't know. Maybe Cal took all my hearing, but like, it's so loud. People are trying to talk, and I'm like, I want to make sure that I'm communicating. I have no idea what you're saying,
You're
and
like,
yeah,
but you know what? I'm enjoying this beer.
but I'm having a good time.
Let's
Yeah,
get
no.
it.
So yeah, that's my floored. Um,
That's great, Lord.
yeah, I just music, man.
Music. It's so
Speaking
impressive.
of, someone out there, please give us some intro music because we're still
I
here
know. We're still
singing. Not we
we're
haven't
still
sung.
doing
We
it.
haven't sung it in a while, but yeah.
Yeah, it has we
So
haven't
what's
should we now? Should we now?
Pelvic.
Ooh, are we going? Yeah.
Um,
Uh, 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 uh,
I like
uh,
this
uh,
part.
uh.
Are we on
uh.
beat?
And the pelvis. We're on the pelvis. And we pelvic. And we pelvic. And we
Maybe someone will do it just so we stop. That would be cool.
pelvic floor.
The
Okay,
pelvic
yeah.
floor.
So
What are we
there it
talking
is.
about today?
There it is. Are we debunked?
We're debunking.
Debunking.
Debunk. Get on
Debunking
debunk.
popular. Get on these bunks, then get off. Because we're
Yeah, yeah.
debunking.
Get off. Get off the
Get
top
off.
bunk, bottom bunk. I'm on the bottom.
Don't put me on the top, I'll fall off.
There's
I'm terrified
railings.
of the top bunk. Bunk.
Oh,
Bunk.
oh, I knew this. I knew this. No, no, no.
Yeah,
Kelly,
yeah. Fell
bottom
off as a
bunk.
kid. Eyes rolled back into my head.
You know, one time I had to sleep over. I had a bunk bed as a kid, and my my poor friend. It was like my birthday party. So there were like 8 girls, and there were like 3 of us on the top bunk. My poor friend, she just head into the fan.
Shut up.
Ka-thunk.
Into the back.
Yeah, mm.
Ba-doom.
She's okay. She's fine.
Oh,
Living
good.
her
She
best
made
life.
it. I
Yeah,
mean,
yeah, yeah.
I'm fine.
But I
Can't tell
remember.
you. You were like, I was scarred.
Like, I'm so
Kimberly,
sorry.
yeah, pushed me off the top in the middle of the night.
What else are older sisters for? So the
Let me tell you.
Bunkins, we yeah, we're on the bunk.
We're on the
Just
bunk.
general things that people think when someone's like, "Oh, go to pelvic floor PT," or "I go to pelvic floor PT," and they just may not know. I think we've touched on this slightly in some different
Yeah,
episodes, but just
capacity.
like I feel like most people, if they call and they're like pelvic floor PT, and then they're just like, "I already do kegels, kegels,
Kegels. Kegels. Oh,
keg,
let's debunk
keg,
this right now.
kegel like a bagel."
Kegel like a bagel. It's not a kegel. It's someone's last name.
A
And
man's.
yeah, isn't
Not saying, I mean, a man can do kegel. Oh my God, kegel.
Kegel. How many times can we say Kegel? It was named after a man. Classic. But yes, it's a Kegel, and men can. Everybody has a pelvic floor, so anyone can do a Kegel. But
Right.
yes, it was named after the man who founded them, and it is so funny because what research has shown is that 50% of people, when you ask them to do a Kegel, they do it wrong. And then
Mm.
25% do it right, 25% do it like inconsistent, like maybe sometimes it's good, sometimes it's bad.
I'm trying to do
So
one right now. It's a lift in the pelvic floor
it's a lift of the pelvic floor coordinated with your breath,
as
or
I breathe in.
yeah,
Sit better.
or well, there are different types of Kegels too. So what is a Kegel? It's a relaxation followed by a contraction of the pelvic floor. So an inhale, expansion, exhale, contract, because you want that full range of motion. Or you
Hmm.
can do an endurance-based Kegel, which is where you breathe normally, but you hold the pelvic floor lift. I don't know why I did this.
This is what we're
Yeah.
doing.
This is so you go open
This is your
palm to
floor.
closed. This is your pelvic floor. No, don't do that. That was a terrible noise. And so it's a lift and a contraction. Endurance is that you hold that contraction
Okay.
and breathe normally. And ideally, I think I know the gold standard is 10 seconds.
Okay.
And then there's also quick flicks, which are really fun to say, but it's when you're breathing normally and you quickly contract, quickly release all the way.
Okay. Okay.
And you want to do it like there's like power kegels too.
And so generally the goal of a kegel is like conditioning the pelvic floor. Like, what are we trying to accomplish with a kegel?
Oh my God. Thanks for teeing me up there.
Well,
It
I'm like,
It depends.
of
So
course.
for some people, it's like working on just coordination. Where is your pelvic floor? What is it doing? Do you know how to move it? Do you know how to lengthen your pelvic floor? Do you know what it is like to contract? So that you can, because Kegels ain't everything, baby. And most people don't need them.
And some people shouldn't be doing them, right? Which is even more difficult when someone is like, which I mean, I would do this too. Let me just Google what should I be doing pelvic floor PT. Kegel comes up. Okay, great. I'm gonna try to do that. And then goes to see you and you're like, stop doing Kegels.
Yeah.
Blow to
Well,
the ego.
and there's so much on the internet that's like, I think there's someone, and no yucking their yum, no diss to them, but they're like, okay, we're gonna squeeze to the beat of this song, and you're just gonna go, and it's
Oh,
like, okay, that's generic for a bunch of people who might not be needing to do that,
yeah.
and so. and might be doing it wrong, right?
Mm,
So then they're kegling and they're consistently doing something that might be causing more dysfunction. Yeah, especially if
same.
it's tension. So I would say that's where also like get evaled, know what it's about,
Yeah.
know how to engage, know what like you might not need to do Kegels. It'd be good to know how to. But yeah, most of it's coordination and then to learn how to strengthen
Hmm.
because Kegel is an isolation. You're not getting all of the pelvic floor and it's like contracting your bicep in the air, right? Like we're not gaining we but now I know how to, right? Yeah. I do this all the time to show people like
I
if
like how big this looks. Like, yeah. You don't know. There's real
yeah,
muscles under there.
you don't know what's here. But I like to use this as like here's the diaphragm, here's the pelvic floor, and the diaphragm lengthens, you inhale, pelvic floor lengthens, and then as you exhale, they both rise up
Ooh,
and in,
this is a
right?
really good visual.
Right? But then if you have a tight pelvic floor, well, when you inhale, it doesn't move very much. And then you exhale, well, there's not much squeeze, right? And then think
Hmm.
about when you cough, sneeze, laugh, pick something heavy. That's pressure from the diaphragm, from the body. Well, if there's not much room, I can't squeeze anymore. The only way to go is down.
Hmm.
Leakage. Doesn't matter. Or,
Leakage.
well, leakage. And so or vice versa, right? If we're like real lax and we don't have a lot of contraction power down here. So
Right.
we need both. But yeah, so Kegels function for different things like endurance, building the endurance of the pelvic floor, building coordination, and then ideally you put it into exercise or bigger activity so you can recruit more and increase intra-abdominal pressure, and that can load the muscle more. So like adding weight to your body, picking things up, doing squats, lunges. Uh, People love a dead bug.
Oh yeah, love a dead bug
Love a dead
in
bug.
my house, outside of, no, I'm just kidding. Um, so okay, do you know much about Mr. Kegel, Dr. Kegel, Sir
You know,
Kegel?
I don't know much about Mr. Kegel.
I was just
Other,
wondering if he was a PT or like a, I don't know.
I think it was. I could be mistaken. I'm pretty positive he was an. Let me. I think he was an OB
I feel
or
like that would make
sometime.
sense.
But you know,
A gynecologist,
it's crazy the history of pelvic floor stuff, though. You know, for prolapse, people used to push pomegranates inside of them.
you know? I think I did know that.
Um, oh, here we go. Uh, yeah, he was a doctor,
Yeah.
um, and researched the development of the Kegel. Arnold Henry Kegel. Yeah, there ain't no denying that. 1940s, which is kind of
Nice.
crazy. That's like
Yeah.
so recent. And so
Oh,
all of that
I
to
was
say,
thinking the reverse, but yeah.
yeah. Oh, you were thinking that's been a while. It's been a
Well,
long
just
time.
like, I don't know, I feel like you said, the history is pretty crazy. It's come a really far way in sort of a short amount of time. But so like even if you had been like, oh, the 60s, I would have been like, oh yeah. So like, oh,
Hmm.
40s is better than I thought.
Yeah,
All
comes
right.
right
Well,
around the same time as the birth of the pill was in the 50s, like when it was able to be mass produced and pushed out. So
very
birth
important
control.
too. Yeah.
Hmm.
Well, I
Hmm.
like how you're like the birth of the pill.
The birth of it's a really good
The pill
book.
birth.
I always
Oh,
think about it's a book I read about how birth control came to be. And so I always am like, well, you know, the birth of the pill. And then I'm
no,
like,
I
oh
love
wait,
that. I need
it's a
to
great
read that.
book.
I'll add it to my never-ending mental list. But I should read more educational books as well. I know you do a lot of like nonfiction, and I'm like, get that in the rotation.
I like yeah, I read that book about cadavers, which was so interesting.
Yeah, yeah.
Yeah, I like to add it in, but sometimes they get really, you're like, God, I feel like I'm reading a textbook.
I mean, I would still rotate. Like I wouldn't just do nonfiction, but
Yeah, you gotta
I think I need to add it in.
how many
So
books do you read at a time?
actually reading so many right now, only because I'm like slogging through this audiobook that I like I will finish because I feel like I have to. I'm
Milking Farms?
no. How's that going? No, I'm listening to the Poppy Ward trilogy and I feel like mixed about it because I think she's such an impressive writer, and it's her first like series. But it is long, and I don't really care about the character. Like everybody kind of sucks, and then everyone
Mm.
keeps dying, and I'm like, I feel like this is only going to end in death. And it's a lot of like she pulls from real history inspiration, and so there's a lot of like connection. And I just so anyway, I'm also reading. I started Shield of Sparrows based on Kayla's recommendation.
I started that last night.
Oh my gosh, I'm already like 30% of the way through, but I'm reading that, which is hard for me to like sit down and read. And then I'm also going to listen to One Golden Summer because I finally got it through Libby. So
Oh, nice. Yeah, I
so
just
I'm just
started
gonna
that on my
mix it up.
Kindle.
Yeah.
Yeah,
Oh my
you're.
gosh. So let me know how it goes.
I
And
will.
then I'm also gonna do The Frozen River for book club.
Oh, yes, I got to do that. Well, I'm in the second book of Akatar,
Oh yeah.
and I'm just fuck everybody in that book right now. Excuse my language. Everybody is making me so mad, and everybody is telling me that this is the best book in the series, and I am just flabbergasted. I
Pretty
like
sure I
that
was one of
word this
those
week.
people.
Well, no, it is really good to the point where I'm like, I cannot wait to sit down and
Well,
read.
I just
But it's
really
like,
disliked the first one. And so everyone was like, read the second one, read the second one. And I was like, okay, whatever. And I was like, oh, this is like,
okay.
I liked it more. But yeah,
Well, I find that you are such a book connoisseur. I really respect your opinion because I feel like you are so well read and you're very creative, and I just really respect your opinion. And so
that's
when
very
you're
sweet.
like, this book is going to be good, well, I trust you. Also, you read a ton. Melissa is brilliant. And I, y'all, Melissa will be like, the reading style and the writing style. Did you see all these grammatical errors? And I'm like,
Well,
la, 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 la.
that's just me
This
being
book's about
picky.
love.
Like if you
No,
if you can't say anything else against a book but the grammar, like okay, Melissa, I'm gonna
no,
shut up.
but
Like,
like
have you written a
you,
book?
no, but like you are really like considering the writing, and like I think that's so powerful, and also speaks to your background because you are a writer. I I don't even notice the grammar, which is a little concerning, but
No, no,
it
because
just
your head
doesn't
is
even.
full of pelvic floor knowledge, which we are
No.
going to get
So, oh
back to
yes, yes.
because here
So
we are
sorry,
on book
guys.
corner.
Or book corner. Just a little excerpt. Anyways, but I'm really enjoying the second book, but everybody's pissing me off, and I am in love with the person who's. I love Reese, and I'm not afraid to say it.
That's
Eh,
okay.
But I'm
Live
also like,
your truth.
what is gonna happen? And everybody is being so. I truly believe every book could be solved with miscommunication. And this is why I've been to therapy too much because I'm always like,
Well,
wow,
that's like the
everybody
whole
just needs
point.
to
It's
sit
like
down and talk.
misconnection. That was the whole, yeah. I mean, how else are we going to have conflict?
You're not wrong. Okay, so
More
what
myths.
and yes, second myth about what is pelvic floor therapy to regular therapy. And Melissa, I want your
Yeah.
take on that.
Well,
Hit me
I
with
actually
it.
haven't done regular physical therapy, but and I think we talked about this in another episode. Just like Austin had to go when he broke his arm, and it was a lot of like rehabbing the muscle, or like I remember he was given this like sponge that he had to squeeze and like do these exercises with, and he was really bad about doing them. But like, so that was when you were like, oh, I'm a pelvic floor PT. I was like, okay, like muscles and interesting. And then, but then you like did your residency at Johns Hopkins, and I was like, really advanced pelvic floor. Like, I was just like, what? There's like levels. And so, yeah, I just knew it was more involved and
Mm,
more like not personal, but like you're really, really getting in there. And so when people call and they're
intimate.
like, I already go to PT and I already saw someone for pelvic PT and it didn't help, I'm always very,
Skip.
what's the word? Like, can't think of words. You know what I mean?
Skeptical?
Yes, ma'am. Skeptical.
Concerned?
I'm like, well, did they do,
What did they do?
which is so rude, but there's a lot of PT places in our area that are still great physical therapy clinics and everything, but they just are not pelvic floor certified. They're not going to do an internal exam. Or even, like you've said, you can do an external exam around the pelvic area and still learn so much that, like, a typical PT is probably not looking for. Because most of the stories I've heard from patients before they come in is, oh, I go to this clinic 3 times a week. They have me exercise a certain way in front of them, and then I go home. And I'm like, sorry, I'm doing this a lot because of Cal.
No,
More.
more. It's
um,
more problematic.
yeah, like, and again, I've only done pelvic floor PT. Oh, hey, Lily.
Sorry,
What you think, girl?
she was wrapping around. What
Should
you
we
guys
just,
can't see right now
oh,
is, oh, me and Melissa's cats. Oh, do you
just
hear her purring?
sweet girl.
She's being so, look at this. Look at how
She
beautiful.
just wants to be in the host situation.
Yes,
Will
no,
you
but
be our producer?
Lils, but you are so right. It's so often that people claim that they're pelvic floor physical therapists, and this might be a little bit of a hot take or a little biased, a little, but yeah, there is a difference between someone who takes an interim one continuing ed class of getting the vaginal exam and learning how to treat incontinence to someone who's board certified and
Hmm.
has completed all of the continuing ed and centers their practice around a full pelvic health load. And
Yeah.
I think that exactly what you're saying is oftentimes what we see. And there aren't a lot of pelvic health providers. And so this isn't to say, like, I want people to do this, I want people to continue to grow. And I know that not everybody can do a residency. I was really lucky that I got in, that
Lucky.
well,
Hmm.
I put a
It's
lot of
because you're
effort in.
amazing.
Very sweet. I did
I
do,
do think
oh,
I do think you should say all your credentials. Just a quick
okay.
rundown again.
Yes. So I'm gonna give the like I'll go in a little more detail than I normally do. So also while I was at Emory University, so you graduate physical therapy school a generalist. What does that mean? I could have gone into acute care, so the hospital. I could have done orthopedics, which is more of the like what you would typically see as a chain, like benchmark, ATI, balance, phys, whatever. Which is orthopedic, mostly meaning like, yeah, skeletal, muscular, neuromuscular. You're treating like someone who has frozen shoulder or got a hip replaced or any type of like pain. That can also include sports.
Yeah, just kind of like what you think of with like
Yeah.
typical PT. Not
Yeah.
to
When you're
put
like,
everyone in a bubble, but that's kind of
yes.
the bubble.
And then um you could also go into geriatrics or like more of that like long-term facility, like nursing homes, LTACs, long-term acute care. I mean, there are other like different types of PT, but let's say like, right, orthopedic acute neuro, which would be more of like post-stroke or brain
Mm,
injury,
yeah.
and pediatrics, which
Oh.
I think, yeah, so cute. And there are levels of pediatrics, right? Some people treat like adolescent to like teenage. I don't know.
Mm,
Yeah, I'm like a little older. And then some people are like just pre like 0 to 5
yeah.
or school age kids. So all through there, I graduate, I can do whatever I want. Emory's program, I was able to do research onto what I like was interested in, and my electives I took were like more centered towards pelvic health. So I did a study on running and clothes for women who are postpartum. I also did a yoga for pelvic pain case study, which was really fun. And then I also completed my YTT. I petitioned to
Yeah.
have my YTT included as that.
Yeah, you
So
did, you little yoga teacher.
yeah. And okay, so when I was in residency, I got into Hopkins. I completed APTA, which are National Association. Gosh, this feels like forever long ago. But so I did level 1, level 2, level 3. So that all includes urinary, vaginal exam, rectal exam, bowel function, neuro, men's, and peds. So I completed that, and that gave me my CAP certification, which is a
Oof.
certificate in pelvic health achievement. Yes, lots of
It's at
courses,
the
lots
end
of
of
time.
her letters, or her
It
name and the letters.
is. And then while I was in residency, I was receiving multiple hours a week of mentorship and completing different research we had like a round table each week, and we would have all these research articles we'd have to read and then like reflect and discuss, and then they would present on a different topic, and then we observed different surgeries, things like that. And then I also took the labor, it's like prepartum, peripartum, postpartum, all this. It's like basically like during pregnancy, during delivery, and then
Yeah.
like intrapartum, and then postpartum, like post. I took all three of those labs. Trying to think about what else I took. Took the dry needling continuing ed. I also took the
I
pessary
love dry
management
needling.
course. We love dry
Oh yeah,
needling.
pessaries. Those are big.
Pessaries, I am able to fit people for pessaries, and my mentor at Johns Hopkins was one of the first people to create the course for pessary management with urogynecologist Dr. Gruber. Shout out Mary Austin. So like a little bit of the background, and then I applied for my
Just
board
a little bit.
certification. Just a little bit. And then
That's just
board
a light
certification,
touch.
light touch. And for boards, I had to submit a paper with 20 research articles. I had to um like basically answer all these questions, and then you study for like 6 to 8 months,
Yeah.
and then you take the exams, 200 questions, and then they tell you 3 months later, which is awful. All that to say, so like, yeah, I am well certified and have put a lot of effort into what I do. And I get that that's not possible for everyone. So I just think being really transparent on your experience as a physical therapist is important. And I could
Yeah.
say that for any doctor, and Melissa, like any career, like,
Right.
right? I feel like it's easily applicable to say, I don't know. Let
Hmm.
me ask someone else. Let me refer you out. And I
Right.
think that's what we run into, is that someone takes a first course and they're pressured maybe to say, like, now we offer pelvic health. And then they get
Mm,
referrals of people that maybe they don't know how to manage, and they don't have mentorship for someone to
yeah.
help them. And so it's then them being like, well, I guess we'll just try it. These are the tools I have. But pelvic
Right. And it
health
could
is
be
its
like mixed, right? Like, I mean, you could find a patient who I don't want to say has like a lesser issue, but they go into that PT and then they do get help and it does feel better. And then that PT is like, great, pelvic health.
easy.
And yeah, which I like so happy that that works for some people. And like at the end of the day, we always tell patients we just want you to feel better. And so
Yes.
like even if they don't come to us, I'm always like, well, please, if you're gonna look for pelvic health PT, like please look at credentials, look at trainings, look at certifications. And people are always like, what? And I'm like, there's 4 levels, and like I'm trying to
There is.
give them a
You're
quick
crushing
rundown.
it. But it's so true, because it's like, yeah, just like be smart about your consumption. I tell my patients this with all of their healthcare team. I'm like, if you feel like no one's listening to you, go somewhere else. You know your
Mhm.
body best. And I'm not saying that in the way of like, we shouldn't trust healthcare providers. We should trust your doctor.
Yes.
And, it, and, you know, it's important to be heard. And if you're not feeling like you're making progress. And I think sometimes that
Right.
gets blamed, especially in PT, because they're like, well, are you doing your exercises? What's going on? And ultimately, our job is your exercises should fit your lifestyle. So, like, my job is
Mhm.
to give you the right tools and package them well for you, and enough to where you understand, which starts with you, right? Like, how you're like, well, that's interesting. Oh, they didn't do this, this, or this.
Mhm.
Like, I'll usually ask patients, I'm like, well, what did they do? What did you guys do? Tell me your homework. There's so many ways to skin a cat, so many ways to do PT. I know. Ugh, you and your Bolo. Don't skin that cat.
No,
Um,
but you're completely right. Like it there's just so many different, and we even have patients who you guys co-treat and they'll be like, okay, I went to Kelly for this and now I'm going to go see another PT in our clinic for this, and it all comes together in such a beautiful way that they're feeling better. Or like even if it's just like appointment times didn't work and they're like, now I got to see this person, but it's still working. And so I don't know what I'm trying to say here, just
no,
all of
you're
it
right.
together, a big
It,
puzzle that we're just trying to
yes.
complete.
Well, and I think you made a good point of, it's often it's not the simple cases that I'm worried
Mm,
about of people seeing. Like, yeah, some stress incontinence, urge incontinence, super easy to treat. They usually do really well. It's the people who come in and have 16 diagnoses, right? Or it's like, I am postpartum, now pregnant again. This is my fifth babe, and this is my lifestyle. I work and live on a farm.
I lose
Ignore
you.
the fact you haven't touched anything in a while, so
You were
everything went
like,
black.
I live on a
I
farm,
was
and then
like,
you went
oh my
dark.
God. So yes, it's if just and she has low back pain. She has lower like abdominal separation. She has urinary incontinence, gas incontinence. She had like 3 previous tears, and her lifestyle is really intense. She's taking care of like these children. She has a job to do. How are we going to make
Right.
this functional and it fit? And how are we going to address it all, right? Because this is the back pain, the reason that she has the incontinence and also is struggling with, you know, all this other stuff. Is it the diastasis recti, the ab
Mm,
separation? And then you find out that she has an old, like, back injury. She used to be a gymnast for 18 years before she settled
yeah.
down on her farm. What's that about?
Yeah.
I just feel like it can get
Yeah.
really
Well,
messy and
and
complicated.
and people will be like, well, I really need to focus on this PT that I'm having, like with my shoulder. And then I'm always like, could you please come into our clinic? Just because they'll go, not saying that the other PT's not doing a good job, but they'll go over everything. And I'm like, you guys are so well versed in your ortho experience as well. And so I
Thank
hate
you.
for anyone to just be like, well, I'm gonna, forget about the pelvis right now. And I'm like, oh. And also, especially with back pain, I'm like, but actually, if you come in and your pelvis, the back
It's
pain
all
is probably gonna go
connected.
away. But so yeah, it's like I want everyone to feel better, and I hate that people have to go to like a billion providers, and that's just how it is sometimes. But like, please come to pelvic floor PT.
Yeah, I agree. And it is so funny how people come in and I think they're so surprised that I'm asking them all these questions
Oh
and
yeah,
being like, tell me about anything else that you're complaining about, right? Oh, your
yeah,
jaw? We're gonna treat
yeah,
it. And
yeah,
it's so holistic. And I think that's the piece that people miss. They think pelvic floor PT that we are witchcraft and we're just doing weird vaginal rectal things.
I
And
mean,
sometimes we are, but also not witchcraft. Sometimes we are, trying some different stuff on. But in the scape of it, it's a very holistic way to treat people, and it's super full
yeah,
body.
exactly.
Um,
So I think I do think, or it seems like, and maybe it's just because I'm working in a pelvic floor clinic, but it does seem like more people are realizing the vitality of it or how this can solve some other problems as well. So I do think this myth is on the way off the bunk.
bunked.
Hopefully.
Yeah. I mean, Melissa, I feel like your experience at pelvic floor has been really full body. I mean, your
Yeah.
upper traps, your glutes, like,
Yes. Kelly has touched all of me. Please help me. Yes, very grateful for that dry needling, like continuing ed that you did.
me
Um,
too.
yeah, I think there, and I mean, it's hard because I'm like, "Oh, what a place of privilege. It's because I'm your friend and I know you and you've treated, like I wouldn't have gotten into this without you, and I've benefited so much. So if everyone could just go get a PFF,
No, right?
they'd be better for it. So, but Kelly's
Oh,
mine, so back away.
I do. It is funny, like, to think about. This is my favorite. This is the favorite. When people are talking to me and they're like, I don't want to ask you a question. I'm like, please.
Yes.
I love sharing it with the people I love. And so if my job was just to take care of my friends and family, I would be
But you're
astounded.
doing a great job. You've seen so many of our friends like in a patient-doctor relationship, and I think that's so cool that you can do it and that they're down for it too. Like, I mean, some people maybe don't want to do that, but yeah, it's only helped. So,
It's my best. I mean, it's my favorite. I love it so much.
which
Um,
leads us into another myth, because I mostly came pregnancy or postpartum as a patient, but I also came prenatally. But the myth of, oh, pelvic floor PT is only for women who are pregnant or postpartum or want a baby, or no, no, we can see everyone. I say we. I'll see you at the desk, but she'll see you in the room.
but you're our first line. You're our first
I
line.
mean,
Yeah.
I
And
try.
also, I like every time I look at you, I'm like, oh my God, you should always wear a bolo tie. It's so cute.
It doesn't even
Um,
feel like a tie. It just feels like a little,
like got
like,
a little cat.
little baby.
So maybe, yes, the pelvic floor is for everyone.
Because everyone has a pelvic floor.
'Cause everyone has a pelvic floor. It's quite. simple. It's let's not. I just I it's so interesting. Yes, I feel like this goes into the other myth of like pelvic floor is for only when you have issues. You know?
Mm.
It's
Yeah,
like,
like don't
oh,
wait for pain.
yeah, no, let's be preventative. You should know how to poop. And if you're out there and you're constipated, that's the
Yeah,
time for pelvic floor PT.
yeah.
It's not to
And it
wait
doesn't
till
have
your
to be
rectum
this
falls out.
way.
Yeah, it doesn't have to be this.
Definitely go then, but go
For
before.
sure, go if your rectum falls out of your body, but also,
There's just I again, fountain of knowledge. Kelly knows so much. They all know so much.
I've
And
seen so much.
yeah,
Burn my
and
eyes. Just
well,
kidding.
just like you don't have
I'm
to
so
live life
fascinated.
in discomfort or pain or, not knowing. Like just if you have questions,
Yeah,
what else are you going to do at an eval besides learn so much more about yourself and things that you could be doing to better care for yourself or be preventative, or if you are in pain, maybe you don't realize like the discomfort you're facing is not normal or it needs to be, and you've just adjusted to that way of life, and that's horrible.
yeah. Well, and there's so many opportunities in our health to be preventative. And and I want to say opportunities because I'm saying that there's a lot of ways that you can be preventative and proactive. And I think it's quite the privilege to be able to be preventative in your health. And so I also just want to point out that it's like that's not how our healthcare system is set up.
I was going to say not
And
here.
but it's like, but that's how we should be. And that's why I think, what me and you talk about is so important. And not to say like me and you are like, we're this is important, but it is because I think a lot of people don't have access to this information or the knowledge, and they think that they don't need help or that they're like, well, I have to wait till things get really bad. But
Yeah,
truly taking care of yourself is the little things every day.
right.
Water, breathing. And
Breathing, water,
everybody should have
rest.
access. Yeah, access to that, access to like, what does this do for your health and your mental health, your physical health? And that's what I think is so important. So yeah, let's start the wave prevention. Like,
I say all that and I'm like, I would never go to the doctor unless I was ill. But I do agree. Like, and it's just because, again, our healthcare system is not made for that. But if we can put out a little bit of knowledge, if we can put out something that helps, or if someone has a question that we can address through this, like, there we go.
exactly.
Let us be
And
your healthcare providers.
I really feel like being as someone who grew up without access and like and there were no sidewalks in my hometown.
Where
That
you
sounds
gonna walk?
crazy.
Where you gonna
Like,
walk?
I grew up in the middle of the country, and it was like if you're on the side of the road, either you're getting smashed or people think you're
Mhm.
on drugs. And I listen, it's it was hard. Even like after I remember like moving away, coming back with my parents, and I'd be like, you guys have to go outside.
Yeah,
This is not normal. We need to be
you
moving.
need to move your body.
But they would be working 7 days a week. They're exhausted
Right.
and
Again,
they're not.
it's privilege and
But yeah,
I was reading something about somebody I don't remember some study that was like walking is the best anti-aging whatever, and I was like, look at me walking. Like like but
but so true.
it's so important. And yeah, who has the time? Like Austin works so much and I do feel like he at least has a pretty good work schedule, pretty good work life balance. He's on a walk right now. And like you have to carve out time. It's like you with your run. Like it doesn't always present itself in a way that is possible, but it's like, well, yeah, if we could all be out here moving our bodies and walking, then be better for it. I
Yeah.
like that we
I
just keep
think, sorry, I'm like, really, this is so millennial of me. I keep throwing up peace signs. I'm
it's
like,
like
yeah,
snaps. You're like,
yes.
I
Uh
feel it.
uh. But it's so
He
true. It's
actually
like,
just got back from his walk.
oh, it's like putting stuff out there, like that. Yes, you have to be intentional. You have to be, there's a part of it being drive and choice, right? Like
Hmm.
there's a choice. And some of us have more choice than others. That's all
Yeah,
yeah. And I
which
want us to all move. Yeah,
we
I
do. We
know.
just want to move.
And
And
also,
that leads us into, oh, wait, sorry, what were you gonna say?
no, no. What does it lead us into, Melissa?
Well, just like how we're like pelvic floors for everyone, men out there,
The
male
men, boys,
persons with not a vagina.
people who own penises.
They have a fun question sometimes for me, which I'm always like, because I'll say, my little spiel is like, and at the first visit, they'll do an internal assessment to really, assess those pelvic floor muscles. And sometimes, generally, men are like, okay, cool. But they'll be like, I'm sorry, did you say internal? And I'm like, yes, up to your comfort level, with your permission, all your consent. You don't have to do it, but
We're
you
not
can,
gonna
and it's
close you in
helpful.
the room. Yeah,
Yeah,
but
yeah.
you want the info. Yeah, it's really funny recently. More and more, I've actually have a wave of like groin pelvic pain from men coming in through the clinic, and they're so wonderful and hilarious. But they're like, do what? Say what now?
Yeah. Yeah, you're gonna do what? And I
I'm
I
like,
remember
that
like
rectum,
one of the
multi-purpose.
PTs, she worked with a male patient for a while who's an athlete, and he was like so against internal. She didn't do internal for like I think like 6 visits, like 6 weeks. He was going weekly. And she kept telling him, like, I know exactly what muscle I need to get with like a wand or like whatever tool she was going to use. She's like, if you just let me get that and release it, like you're going to feel a lot better. And then you're going to be able to do it yourself at home. Like you just need this tool. And I remember she was so excited when he finally agreed and she did it and he didn't have to come back because when she got that, she recreated his pain and she was like, okay, here's your tool. You're going to do this. And then let me know what you need in the future. It's like,
Yeah, it's
so
incredible. It's so cool. That's why I love the Therawan. And
yes,
I
that's
find
exactly what
that,
it was. It was a
yeah,
Therawand.
I find that that's the thing is like once I can show them that I can recreate their familiar pain, they're so, oh, thank God somebody put their finger on it because they keep going places and they're like,
Literally.
nobody, yeah, nothing can help. And so most of the time it's like we get to the wand and they're like, this is phenomenal. I'm like, I know. And now you have that tool for the rest of your life.
Right.
Like, if this pain comes back, you can do that same thing.
Yeah.
And that rolls us right into that it's also for kids.
It's also for kids.
Yeah.
Because I
Potty
mean,
training, bedwetting,
sorry,
constipation.
my kid just got home, so you might hear him
Ah!
on this. But I do want to ask more about the kiddos next time, not to cut this
Yes.
short, but
Honestly, that
I
we might need a whole, maybe that's our next
I think
episode.
maybe some potty training, which would be great for me. I need some potty training. No, no, just some tools for my child. So those are some myths to debunk.
Debunked.
We're gonna
I
stop
feel,
doing this, I think,
I'm gonna,
eventually.
I gotta control my hands. I feel like
Oh,
that, what's that movie where he's like, I don't know what to do with my hands. Is it
I don't know,
Bobby?
but we're in it. We're right here.
Or in it. So that's pelvic floor. If you have any comments, questions, Albie, you're looking for some cat
Albie and
love.
Tiger Lily will be addressing those questions. So
Yes.
yeah,
Um,
PFFs, hit us up.
we yeah,
Let you know
any
what you think of
questions?
this
Tell us
video.
your stories. If you have a myth, we'd
Oh,
love to hear
yes.
it.
Or what you think might be a myth, a real
Oh yeah.
one.
All right.
Until next time, PFFs.
See you PFFs. One last peace sign.